We will be waiting after the pitch. Thank you.
Did you know that more than 600,000 patients have a knee replacement surgery every year in the United States alone? Almost 50,000 of them will require a revision surgery. We are Silko, and we are here to solve one of the most catastrophic reasons for these revision surgeries: the infection of the artificial knee. The revision surgery itself is complicated, costly, painful, requires long rehabilitation, and the most significant thing, it can be entirely avoided if the bacteria is caught on time. So where is the problem? The problem is that most infections are asymptomatic. The patient may not feel anything, and if they do, they may shrug it off as normal post-surgery pain. And so they delay with going to the doctor. But by the time the infection spreads, it's too late. The knee is already contaminated, and the bacteria has already built a defense from antibiotics. And this is a big problem. The treatment in this case would be complete eradication of the bacteria by entirely removing the implant. And what if the infection has been detected in time? Well, in that case, it would be a minimally invasive procedure that won't require hospitalization. Unfortunately, there is no way at the moment to detect early infection. And this doesn't affect only patients, but the whole system. Revision surgeries are a significant economic burden which is only expected to grow as the population ages. We provide a solution by implanting a sensor that tracks physiological and biomarker changes and is compatible with any of the existing knee implants. And we envision Silko as more than just a sensor. It's an end-to-end system that includes a sensor, companion app that alerts the patient if there is an infection, cloud-based analysis, and an end-user interface that allows physicians and researchers to analyze the data.
We define our proof of concept as being able to identify the minute changes that separate early infection from the healthy knee. We already constructed a prototype that's capable of detecting some of these slight infections and transmitting a signal out to a companion app when it does. From de-risking analysis that we performed, from looking into the existing solution landscape, from an IP standpoint, we have plenty of room to operate with our sensor technology. So this is a very large and very defined market, and we want to slide into the existing ecosystem from every angle possible, from how the surgeon implants the artificial implant during surgery, to how insurance companies provide reimbursement and pay for the device. Once we prove our safety, we'll be able to approach orthopedic key opinion leaders and get them to use our technology as part of their clinical practice. Ultimately, we aspire to partner with major implant companies, and provide our technology to them so that they can integrate it into the kits that they provide orthopedic surgeons. We already made contact with one of such companies, and we hope to continue working with them as we progress our technology. The biggest advantage that we offer is that we stand alone in the existing solution landscape. Sure, there are plenty of low-tech solutions that offer infection detection, but they all require the patient referring themselves to the physician once they become symptomatic. They require the patient go in themselves, which, as we explained, is problematic. There are other companies that are experimenting with putting in sensor technology to their implants, but they're focused on things that are not infection. We are the only ones trying to look for the fingerprint to mark early bacterial infection, and we believe that the value that our insights can provide are relevant not only for the knee, but also to other orthopedic branches, as well as branches in medicine as a whole. In conclusion, we offer a solution that does not require patient compliance, a solution that can seamlessly integrate itself into the current clinical landscape, a solution with the potential for high sensitivity and high specificity in early bacterial infection, and one that is adaptive to other branches of medicine. And finally, a solution without any major competitors, a solution that can be protected by IP and offers diverse routes to monetization. Our team is a multidisciplinary team consisting of engineers, computer scientists, and clinicians. We were led by mentors, who I want to thank for their support and guidance over the past year. And we are all excited to tackling our problems head on as we approach the future. feel free to come stop by our station so we could explain to you more about our vision for early infection detection. Thank you very much.